Urea, found in Hydro 35 foam, is used to treat dry and rough skin conditions like eczema, psoriasis, corns, calluses, and some nail problems including ingrown nails. It can also help remove dead tissue in wounds to aid in wound healing. Urea works as a keratolytic, increasing moisture in the skin by softening and dissolving the keratin that holds the top layer of skin cells together. This helps the dead skin cells to fall off and allows the skin to retain more water. It is recommended to apply Hydro 35 foam to the affected areas as directed by a healthcare professional and use it at the optimal time for best results. Make sure to use Hydro 35 foam exactly as directed by your doctor or as indicated on the product package. Some products may need to be shaken well before use, so be sure to check the label. Apply the foam to the affected areas of the skin or nails as instructed by your doctor, typically 1 to 3 times a day. Rub it in well until it is fully absorbed, and remember to wash your hands after applying unless you are treating the hands. The frequency of application will depend on the specific product and your skin condition. Only apply the foam to the skin or nails, and avoid sensitive areas such as the eyes, lips, mouth, nose, and vaginal/groin area unless directed by your doctor. Make sure to ask your doctor or check the label for any specific directions regarding where you should not apply the product, such as the face, broken or irritated skin, or recently shaved skin. It's important to use the medication regularly to achieve the maximum benefit from it. If your condition persists or worsens, be sure to inform your doctor. When using Hydro 35 foam, you may experience burning, itching, stinging, redness, or irritation. If these effects persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, if you do notice any unusual changes in the skin, such as blistering or peeling, or signs of a skin infection, it's important to contact your doctor right away. Additionally, if you experience a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. For those in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Hydro 35 foam, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of skin cuts, infections, or sores. Some products may increase your sensitivity to the sun, so be sure to check the label for any warnings and ask your doctor or pharmacist about any special precautions you need to take. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, contact your doctor immediately. Also, be aware that some products may stain or discolor clothing, so consult your doctor or pharmacist for more details. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is unclear whether the drug passes into breast milk, so consult your doctor before breastfeeding, especially if you are applying the product to the breast area. It's important to be aware of potential interactions between Hydro 35 foam and other medications you may be taking. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never make changes to your medication dosage without first consulting your doctor. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to call 911. Otherwise, contact a poison control center immediately. In the US, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Always keep this medicine out of reach of children to avoid accidental ingestion. Remember to take this medicine exactly as prescribed by your doctor. Remember, you should not share this medication with others. This medication has been prescribed specifically for your current condition. Do not use it later for another condition unless your doctor tells you to do so. If you have a different condition, you may need a different medication. Always follow your doctor's instructions. If you forget to use Hydro 35 foam at your usual time, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Don't try to make up for the missed dose by using extra product or using it more frequently. Stick to the recommended dosage and schedule. When storing Hydro 35 foam, make sure to keep it at room temperature and away from freezing temperatures. Avoid exposing the foam to heat and open flames. Since the foam canister is pressurized, it's important not to puncture or burn the container. Keep all medications out of reach of children and pets. When it comes to disposing of Hydro 35 foam, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.